The countdown to the 2026 FIFA World Cup is on. In just 5 months, Toronto and Vancouver will welcome hundreds of thousands of people from around the world. But with the healthcare system here already operating at capacity, is this clock actually counting down to a disaster for our hospitals?
Are we prepared for that type of event in our cities? And do we have surge capacity? And any given day in Canada, we don't have surge capacity in our hospitals.
Dr. Catherine Varner is an emergency doctor in downtown Toronto, where she says her hospital is operating at basically 100% capacity. And during flu season, they're up to 130%. During the Blue Jays World Series run, they only had one ICU bed available.
It made me worried going into that night how little space I had to work with in the event of needing to care for a bunch of people all at the same time. Because when we have an external disaster scenario, the second stage of that process is actually what's called decanting your emergency department. So making space to care for those who are coming in. And when you don't have other space in the hospital, there's nowhere to decant to.
Researchers say massive events like the World Cup can lead to foodborne illnesses, alcohol overconsumption, or even infectious disease outbreaks, like the strain of measles introduced to Vancouver during the 2010 Olympics. Planning is already well underway to limit those risks.
If there are not enough hospital beds and surge capacity to execute that plan, then we are still at risk of having a situation where we can't provide the best care for patients.
Like many healthcare providers and patients across Ontario, city councillors on Toronto's FIFA subcommittee are calling on the province to improve capacity.
When they're figuring out all the costs and the dynamics around FIFA, they better be able to figure out what a possible influx of patients could mean to our healthcare system.
We asked Premier Doug Ford if the province would provide more resources for hospitals when the World Cup lands in Toronto.
We've invested more into our healthcare system than anyone, over $93 billion. We've registered over 16,000 doctors, 100,000 nurses. We're building $60 billion, 50 sites around the province. We're building new medical schools. So we're doing everything we can to enhance the healthcare system.
Toronto Public Health will also launch a wastewater testing program around the stadium and fan zone areas to try to track infectious diseases being spread during the World Cup. Brandon Choghri, City News.